Welcome back. You're watching Morning Express. We continue with press review, just taking a look at some of the news making headlines, what you can expect to be covered in today's dailies. Politics, of course, has been covered extensively, even as we get closer to the 2022 election date. The stakes are high with coalitions looming. One Kenya Alliance sort of setting the path forward, even as William Ruto's UDA party is charting a path of its own. In studio, I'm joined by Authoritative, who's the former Teso North Member of Parliament. And just before the break, we were deliberating on this bottom-up model. And it's all to do with the hustler movement wave and how Jubilee right now is trying to puncture that wave, especially in central Kenya. They had a series of meetings, they revamped, Jubilee reloaded, quote unquote, and this is what they plan to use in countering the bottom-up economic model. The billions of shillings invested in Uwezo Fund, Youth Fund, cash transfer to the elderly, and that particular Boda Boda investment scheme that was launched roughly late last year by President Uhuru Kenyatta, targeting 1.4 million riders across the country. So, Athodera, it seems they're trying to turn around the fortunes of the ailing party. What say you about this? Is it too little, too late? Because we well know of the tag that comes with the government of the day. When the economy is going bad, of course, the finger is pointed to whoever's in power.
I think, at the moment, Jubilee provides a rallying point for the proponents of that position. But I wonder about Jubilee, because typically in Kenya, if you want a party to be strong and powerful and to have an impact on the voting patterns in the country, first of all, you need a strong person, preferably as a presidential candidate behind that party. Most parties without a presidential candidate that's formidable typically just fade away, or they remain on the periphery of Kenya's politics. Either that they have a strong presidential candidate, or they have a player, a party leader or head of that party, who allies himself or herself with a formidable presidential candidate, and it gives that party life. It gives that party relevance and creates hope for the followers of that party. Without that, it's very difficult to keep a party alive and formidable. And maybe that's why Jubilee has been talking about allying themselves to ODM and Raila Odinga, because as we all know, Raila Odinga has said without saying that he's going to be a presidential candidate in the next election. And those of us waiting for him to say are waiting in vain, because he has already said it. Everything about his activities and about his utterances smells of a presidential candidate in 2022. Now, about the trying to counter the hustler narrative, the wheelbarrownomics, and the bottom-up economics argument that the deputy president is associated with, I think that it points to one thing, that the bottom of the pyramid is a formidable force. Traditionally in Kenyan politics, the leaders, political leaders, people who have the resources financially to sponsor a campaign or to go around campaigning, have been the one leading the arguments, leading the discussions, and shaping the narrative that influences voters across the country. But we now have a situation where the boda people, the young people who are tech savvy and are able to access social media, some of them able to do some level of research and understand what goes on, are now presenting themselves as the face of the bottom of the pyramid.
Okay.
And when we talk about Mama Mbogas and the watu wa mjengo and so on, these people are now claiming their space and having to be attended to, having to be listened to, having to be taken care of for those who want political positions. And I think that attempt and that program for giving boda bodas a savings mechanism for their money, and also providing them with discounts for fuel around the Mount Kenya region, for me, just underscores that argument. Okay. That there's a recognition that these people need to be taken care of, they need to be thought about. We need policies that actually bring them to the fore and enable them to secure their own financial future. And if they go that way, and present an alternative argument that is compelling, that gives hope, and that creates reality. Because blending hope and reality is a powerful force, because I believe that in this country, politics has a bad reputation. And because politics has a bad reputation, especially on the trust prism, many people prefer things they can see and touch. And if you give boda bodas a 3-shilling discount per litre of diesel or petrol, these are things they can see and touch, and that saving goes into their pockets on a daily basis, and you provide them with an opportunity to save 5 shillings every day, and they see the output, they're able, the finances are accounted for, and it provides hope for the future. And I think that's probably, if they go that way, rather than rubbishing the hustler narrative, for me, that's a much more realistic and a much more effective way of doing politics against the hustler narrative.
Yeah, so less trivializing, more counter-narratives, perhaps. Well, that story is in today's dailies, but also, it's not just politics. Health matters as well. You can definitely expect more details on the vaccination drive in the country, even as the world risks losing COVID-19 gains globally, as cases have increased by 80%. Cases have also increased in the country, because for close to a week now, the number of new COVID-19 infections recorded every day has been on the rise. The positivity rate has been on a steady increase and is now at an alarming 14.4%. The number of hospital admissions due to the disease is also on the rise, leading to a high demand of medical oxygen. The Ministry of Health on Sunday reported 15 deaths related to COVID-19 and 467 new infections. Our reporter Chebet Birir tells us more.
The month of July has seen a steady rise in the number of COVID-19 cases in the country, especially in Nairobi County. Patients who have to be admitted in hospitals due to COVID-19 and their families are facing a rough time since there are not enough ICU beds. Even worse, there is a shortage of oxygen. Fiona Juma is just one of several Kenyans who reportedly lost her life due to lack of availability of oxygen. Her story came to light after she posted on Facebook asking for help, but she passed on just a few hours later before she received any help. This comes just a few days after Health CS Mutahi Kagwe urged Kenyans to strictly observe the COVID-19 containment measures due to the spiking number of cases. The number of cases in Kitui County has dismally been on the rise compared to the month of June.
In observing an increase in cases in other counties, including Kiambu, Kajiado, Lamu, Makueni, Murang'a, Nairobi, Nyandarua, Taita Taveta, and for the first time also, Tana River County.
In Kitui County, basically, we've started seeing the numbers steadily rising. For example, in our facility, the county referral hospital, we found before mid-July, basically the numbers that we were testing positive were around 3 or 4 patients per day. But from mid-July, we've seen the numbers doubling, actually 50 to 60% increase.
Health experts say the new Delta variant is a major factor attributing to the spike in these cases.
If you check, like, you saw people, the viral load is higher, and the duration from infection to symptoms and signs is shorter. And from the time you are exposed to the time you show that you are unwell, feeling lousy, is shorter.
The Ministry of Health has now given a go-ahead for the COVID-19 vaccine to be available for all Kenyans, as this seems to be the best solution for the country to beat the virus. Several vaccines are expected to arrive in the country later on this month.
Discussions with the people treating patients, they are telling us majority of the people being admitted are not vaccinated. And therefore, that is why Kenyans should go for vaccination.
If you're bringing us vaccines and the vaccines have a little under 8 weeks to expiry, we shall not be able to receive them just because of the logistical arrangements that need to take place in deploying the vaccine.
Chebet Birir, KTN News.
Okay, so that's the latest in terms of the positivity rate in the country. It's definitely on the rise, and cause of concern right there, even as just 2.4% of the adult population has been vaccinated. Of course, in the midst of vaccine nationalism, and it's definitely putting African countries at a tough place. Let's start on this particular point, Arthur. Is the government doing enough? And if not, what areas should be improved? Enforcement, when it goes into vaccination, what holes can you pick?
Well, perhaps let's talk about the weaknesses.
Okay.
Because, I mean, in fairness to government, the president, the CS Health and his officials have done a great job, ordinarily, if you're fair, to try and, from the beginning of this, when it arrived in Kenya in March last year, they've done a great job. A lot has gone into attempting to contain the pandemic and to avoid many deaths and many hospitalizations. My belief is that at this point in time, we probably are in the 40s or 50s of the number of people in Kenya who have been infected already, and a great many of them have healed from this infection. Whether that renders them, protected against the virus, and you add that the 2.4 that have been vaccinated, one hopes the answer is yes. There was a survey that was done in November last year, which brought the Nairobi number to about 35% who have been infected and have gotten over it, which, if you extrapolate that into now and into the rest of the country, you're probably talking about 40s and 50s. Whether that helps or not, I think the answer is probably yes. That you then, only those who haven't contracted the virus yet are the ones in danger of contracting it and probably getting critically ill from it. Maybe that research needs to be done, and to actually tell us whether if one has suffered the infection or not, they are protected against the virus, and to check those antibodies. People be able to go and check whether they have the antibodies or not, and know what happens then after that. However, the mask compulsion stays. However, if you go to public places like open-air markets, for example, and fresh produce markets, you will be amazed at what you find there. There is no social distancing. Most people don't wear masks, and therefore they are exposed. In most rural areas, probably 90% of people don't wear masks at all. They go about their business in the normal way. So, to come back to the question of what can the government improve, my question would be, can't the government supply masks to people? If you have a choice between buying food for your children and buying a mask, most people would choose food, because that's where the economy has put a lot of Kenyans. The economy is so bad that a lot of Kenyans struggle to get food for their children, to get fare to go to work, to get school fees for their children, to even just pay for their basic bills of water, electricity, transport, and so on and so forth. So can the government provide free masks? It should be possible to provide free masks, and then ramp up the vaccination. Ramp up the vaccination. All teachers should be vaccinated. All medical workers should be vaccinated. All government officials should be vaccinated. And everybody who has a wide circle of interaction with people, let us start with those ones. Vaccinate them, vaccinate people. And then, because I then foresee another problem, that soon we will be talking about people who are fully vaccinated, the 2 jabs of AstraZeneca. If it wears out over the 6 months as is expected, what then are we going to do? Are we going to take them through a second round of vaccinations? Or what is going to happen? That medical information needs to be available to people so that the gains do not begin to reverse themselves just by the passage of time. We're talking of 2.4 now. Maybe when it hits 6 months for the first lot of 1.0, we will be back to 1.4. Before we vaccinate the others. So it's a challenging thing, and I think that probably for purposes of not causing alarm, the ministry might not be talking about these things, but they're important to talk about, because again, if you consider the way that the vaccination was prioritized, medical workers, teachers, government officials. These are probably the people who have the capacity to deliver messages to the rest of the population in Kenya. Okay. So they need to be knowledgeable enough to deliver that message to Kenya. The other thing, of course, that needs to be really, really seriously attended to are political gatherings. The politics in this country is not only toxic in terms of the messages that we receive, but also toxic to the health of Kenyans, because politicians, because of their ability to pull crowds, everywhere they go, people come. And when people get into a political gathering, they get emotional, they get excited, they let down their guard, which mostly involves taking off their masks. And you actually see politicians, when they take the microphone, they remove their mask, which is an indication, if we are all modeling to the rest of Kenya, that it is okay sometimes when you are in public to remove your mask, and therefore that becomes the norm.
All right.
So the government should really rein in on these political gatherings. Let's stay home.
Events, yeah.
Absolutely.
Okay. Well, they did mention that they're definitely not. They should not be happening right now. But let's see in terms of enforcement. So perhaps we should shift focus to non-priority groups, those who work in the productivity activities to get vaccinated. That would perhaps be a good move right there. But you spoke about teachers and the COVID-19 numbers right now. 96,000 teachers have been fully vaccinated against COVID-19, even as Form 1s are set to join schools. It might bring a new dilemma. The numbers due to 100% transition and the infrastructure in place at these facilities might also be a case of, it might bring a case of coronavirus infections rising. Well, what say you, even as schools reopen?
I wish there was capacity to test all teachers and all schools. And you can see that in the day schools especially are severely exposed because they have no dormitories, but they have classrooms. And you know, secondary school, primary school goers will play. They play and they talk and they are close together with each other. They share books, they share food, and they are always interacting with each other. And half the time the masks are down. I mean, for a young person who wants to play and is vibrant and full of energy, it is very difficult for them to keep their mask on. That's just the reality of their life. And therefore, it needs a high level of care. Maybe the ministry needs to do sporadic testing, sampling of testing in schools, just to find out if there are infections and if there are antibodies in schools and what is going on there. But I think that for me, the fact that schools are open is symptomatic of that delicate balance between, you know, you don't want to bring the education calendar to a complete stop. Life has to go on in the education circles. These children are growing, and the need to make sure that we don't suffer great damage to our people, our health, and our economy from the COVID infections. However, maybe the saving grace is that young people are generally much better able to cope with the virus than the older ones. So maybe there are infections, but one hopes that by the grace of God, if at all there are infections, they're able to go through them without much damage to any of their internal organs, and they're able to heal and go ahead.
Definitely. As we finalize, Arthur, I can see a story on the back page of the Daily Nation. Bursary wars as Form 1s report to school. I mean, you served as a member of parliament, and some of these bursary and scholarship schemes are run by members of parliament and county governments. So with Form 1s set to join schools, we've seen stories, even some top students not meeting the cut in terms of this bursary allocations and settling for extra county schools which they might afford. It's an unfortunate turn of events right here, but financial challenges notwithstanding, we need to support these bright and needy learners. What say you about this bursary allocations, especially in the counties?
Bursary allocations require a lot of care, sincerity, and a lot of communication to the community or the constituents to know that actually bursaries are for the most needy. Because often everybody wants bursary. It's, you know, everybody can do with a little relief here and there, even parents who are able. But bursaries are essentially for the most needy. And if they are meant for the most needy, then the task becomes identifying them reaching them in time, getting them to fill the necessary forms, and then, most importantly, disbursing the money in time. And that is usually where it goes wrong, because a lot of people who manage those bursaries give priority to contracts where there may be an interest rather than pay school fees for these children who are probably the most needy of them all. And sometimes there's a cash flow problem, money hitting the constituency coffers and the county coffers from the National Treasury. But a lot of the time, it's about interests being prioritized over the education and life of these young people, some of whom are orphans, some of whom have parents who are completely needy, without any resources of their own, and therefore need those bursaries most desperately for them to even report to school at all. And sometimes it's a mismanagement challenge in a lot of cases, even though you factor in the delays from government. But what I would do, and what I used to do, is to set aside the money for bursaries, knowing that schools are opening at a certain time, do all the identification of the students, and make sure that at a time when they are going to school, those who have been allocated bursaries are able to pick their check and go with it to school. That way, I think you can help the students so that they don't miss out. They're able to go to school in time, and whatever help is available comes in a timely fashion.
Quite so, and in timely fashion. That's the most important part, especially when the beneficiaries make the final list and they're truly the ones who are meant to benefit from this funds. Many thanks, Arthur Odera, for your time. Former Teso North Member of Parliament. Just taking a look at some of the stories making headlines in today's dailies. Make sure you grab yourself a copy. Much more, not just politics, economy and education matters, also international news. So make sure you're adequately informed. Information is power, as they say. Allow us to take a short break, but coming up after this break is a special report that aired on Checkpoint just yesterday night. A year ago, the KTN News Investigations Unit started digging into a human trafficking ring operating between Nairobi and Kampala, Uganda. And the investigations revealed that there was a connected group of people promising young but poor Karamajong girls jobs in Kenya, only to give them out as house helps and sex workers. This report after the break.